Tēnā koutou, tēnā koutou, tēnā koutou katoa. Ko Tabitha tōku ingoa.
Ko Miriam tōku ingoa.
Ko Janine tōku ingoa.
We work for Waitemata District Health Board in Tamaki Makaurau, Aotearoa.
We are going to talk about the Professional Development and Recognition Program here at Waitemata DHB for nurses. Waitemata District Health Board has a long history of recognising professional competence going back to the 1980s and became an early adopter of the Nursing Council Portfolios for Professional Development and Recognition Program, PDRP, in the mid-2000s. Over the years, paper portfolios became a showcase of professional competence, but came with the challenge of managing the content, distributing the portfolios for managers and peer review, for assessment, and keeping track of their status and physical location. Keen on supporting our staff as best as possible with their professional development, we looked for opportunities to make the entire process easier for everyone involved.
We looked for the right portfolio solution for us. With an extensive analysis followed by a pilot, we launched Kōpaki Tiaki Hauora Healthcare Portfolio in 2019. And now all nurses submit their portfolios electronically. The enthusiasm was visible with 800 nurses attending training within the first 2 months of launch. The PDRP team ensured that nurses, peers, and managers can focus on the content of the portfolio rather than the setup of it by providing templates that can be copied easily and filled in, tying the submission of the portfolio to the learning management system and allowing the PDRP administrator to manage the portfolios for review directly in the LMS. We developed a framework for creation, management, support, and review of electronic portfolios in a streamlined workflow that takes advantage of the selected technologies. The approach continuously looks at enhancing processes further based on participant feedback. Having focused previously on the digitizing of the process and targeted improvements to privacy and security, time reduction, and portability, the next steps will be to support better self-reflection and critical thinking, leading to improvement in nursing practice and therefore better patient outcomes.
Compared to the paper-based system, authentication through our LMS improved security, privacy, and access. Nurses can be anywhere and work on their portfolio and appraisal. They can share their portfolio with multiple people at once, getting input from peers, educators, managers, and professional leads as and when required. Appraisals in the LMS keep everything together, connecting learning and performance planning as part of improving practice. Appraisals stored in the LMS are more secure than saved Word documents, and version control is easier to maintain. The live version is the current version. There is no more, where did I save that file? And is this the latest one? Happening. Merging of the nurse, manager, and appraiser commentary is managed by the system. This ensures everyone is doing the same appraisal questions. Documents have a habit of losing bits as people edit them. This system makes it easier for the manager to view the portfolio when completing the appraisal.
So you can see the mechanics of completing an appraisal and portfolio are there. Staff generally know where to go. There are user guides and videos. There are instructions throughout the process and support is available. But are we seeing improved practice? Are we seeing quality reflection and behavioural changes as a result? The reflection captured in the portfolio is specific to the Nursing Council competencies for registered nurses or enrolled nurses. It looks for specific examples of observed current practice from the nurse and the third parties. Appraisals add discussion on future practice and individual areas for growth. Through the regular interactions provided in appraisal processes, alongside portfolios, nurses can identify the steps towards improving their own nursing knowledge and practice.
Portfolio reflections are supported through instructions on the page as the nurse or peer capture the specific example. This screenshot shows a Nursing Council competency with a guiding paragraph for the nurse to give context to the competency, and some indicators to help them provide an example of their nursing practice that shows how they meet that competency at the level they are applying for. Every competency in our portfolio templates has instructions like this. We give instructions to peers as well.
Our online appraisals give specific guidance to managers and appraisals on how to have development conversations with nurses. Managers can use open-ended and motivational questioning to enable a nurse to critically think about their practice and the steps to obtain their goals. Guidance is also provided to the nurse. Reflecting during the appraisal process focuses development conversations and supports the nurse to grow. Iterative and evolving, appraisals need to be about assessing where the nurse is at, where they want to be, and how the organisation can support them to get there, and how well they move towards that goal.
Regular appraisals help staff to feel appreciated and valued through constructive and motivational feedback from the manager. The current climate means that it is even more important to keep developing and training our staff and to keep showing the benefits of annual appraisals to managers and nurses. Our appraisals consider the professional knowledge and skills determined by our DHB for each of our clinical areas, including primary and community care partners. This allows nurses to see their strengths and their opportunities to grow. Although there is some national guidance in specific areas, there would be benefit in having agreed national standards for determining and assessing the professional knowledge and skills required within the nursing profession. Our DHB and primary and community partners reap the benefits of the planning for workforce development and the strengths and gaps identified through the appraisal process. Linking the online appraisals, e-portfolios, and online learning management systems gives nurses a central place to access their PDRP tools. Although we have linked these systems, we see the potential for closer integration in future under Health New Zealand, capturing a complete workforce view.
Continuing to deliver education is a challenge we are all facing. COVID changed what, where, and how we teach. Already being a highly digitised work environment before COVID hit, there was less impact for our staff than if we were still paper-based. The requirement for nurses to complete 60 hours or more of continuing professional development for each portfolio has led to looking for innovative ways to deliver education, blended online, face-to-face, simulation, on the job, and so on. We are working to implement new frameworks for progressing learning that integrate across services, the organisation, the region, and nationally.
The national requirements through Nursing Council of New Zealand are to ensure that all nurses are competent and safe to practice. Delivering PDRP recognises nurses for their ongoing knowledge and skills in caring for patients. Our shift from paper to electronic makes clearer the connection between appraisals, portfolios, and improving practice. Our education approach enables flexibility, adaptability, and accessibility to all staff to develop their learning and practice. The way we deliver our professional development and recognition program models self-reflection and continuous improvement as we look to how the program grows into the future.
Thank you. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa.